So there we are, profitable healthcare. Well, it still sounds strange in a way, so let's dig a bit deeper now. Sebastian Krolop joins us here in the studio. He's a doctor and an economist. It's good to have you here with us. So, doctor and economist, I'm sure you can explain to us both sides of this rather complex issue. And I can't help, but to me it still sounds like money can actually buy you health. Is that right?
Might help a little bit, but what we have seen in your movie before is that is something we see all around the world today, that big connected health companies, big hospital chains are trying to get better and better. They're trying to win the quality championship there. And in the end, they expect to be efficient. And actually, as a patient, this is not a bad thing, because we have studies which have shown that there's a significant correlation between profit and quality.
Okay, so let's talk about the quality then. If you say profit, higher costs for the patient in a way, also boosts quality. Who pays the price in the end? There's always someone paying the price for this in the end.
Well, it's most of the time, to be quite honest, it's really efficiency. So the hospitals are really investing a lot of money into structure, into processes. So they're doing the same thing they did before, much more efficient.
But not all hospitals. I mean, there was a recent survey that says like 1 out of 2 European hospitals is actually in financial trouble. So they're not all doing it. So what makes the difference then? The
difference makes if you have a hospital chain or a company who's really able to invest a lot, and they invest a lot in infrastructure and in their processes, and then they invest into quality. And you're absolutely right. We see a spread. There's many hospitals who are not able to invest. They're not able to boost their quality.
And why not?
Because they just can't. They don't have the money to invest.
So where's the money coming from for those who can invest?
Well, these are private. Most of the time, they are private hospital chains or private companies, and they are doing a great job. And they find investors who are willing to give money to them, and they take this money and invest it into healthcare.
So if I'm a patient and I have the ability, I'm conscious, I can make a choice, would you say I have to go to a private hospital because simply the quality will be better there?
It's not just go to a private and everything is going to be all right, but yes, if you have a choice, make your choice. I mean, ask around, ask your physician, get a second opinion, ask the physician who's going to treat you. How often have you done this before? What about your complication rate? And then, in the end, you might actually end up in a private hospital, yes.
So as a patient, you really have to study your illness first before you get ill. Now, we're talking about European hospitals here in particular, and obviously Europe has quite a sound healthcare system, which is getting more and more expensive. Now, in the long run, what needs to happen for this kind of healthcare, these kind of hospitals, to still be affordable to everyone? Or are we looking at a kind of healthcare system like a century or more ago, where health is a luxury product only for the rich?
I don't think so. The digitization will boost the healthcare market, and the consolidation of the providers is going to go on and on. So we're going to see less providers, but they're more specialized, they're bigger, and they are much more focusing on quality and specifications.
Okay, Sebastian Krolop, thank you very much for being our guest today.
My pleasure.